full daylight and watching this massive crime against humanity allowing to take part, to unfold. And on this discussion we had on Al Jazeera, the anchor used the word, and now more help is allowed in. Allowed? When was it that the state army could dictate and rule over the whole humanitarian complexity of our world today?
That the world leaders are sitting on inside working in flow line
who
all daylight and
watching
watching
this conflict, in an earthquake, in a natural disaster, in humanity, whatever,
allow you to take part, to
unfold exclusive right to
and
take
on
part.
this
You cannot do that, you cannot do that. And the international community or the Western leaders, they comply. And that's why we have the situation we have today. All of this is 100% man-made by Netanyahu, by the government, by Biden, by Blinken. Everyone who dies, everyone who is killed by the bombs, everyone who dies from incurable infections in their war wounds, everyone who will freeze to death, everyone who doesn't have their insulin, everyone who's scared to death with their mental diseases, is the responsibility of these perpetrators of this massive crime against humanity. And healthcare is at the centerpiece of their tactics. Precisely, as Ghassan said, to intimidate, to scare, and to take away
Recording in progress.
To take away the safety network of every single civilian in Gaza. And by the way, also in the West Bank, the number of attacks on healthcare in the West Bank during the same period, according to the UN document, is 158. Now, what do we do? Last minute. This morning, I participated in a big demonstration outside the largest pediatric hospital in sub-Sahara Africa. It's in Cape Town. And it was extremely moving to see these hundreds and hundreds of young and adult and elder healthcare workers in their greens and in their white surrounding the pediatric hospital, delivering roses to all the cars passing by with names of the killed children in Gaza, and saying this very clear message: we don't accept attacks on healthcare. We want our colleagues and our patients in Gaza protected. We had the same wave of demonstrations in Norway. We had it in UK. So I think we see a new section, in a way, of solidarity among healthcare workers with a very broad-based political affiliation. And most of them may be very apolitical. This is promising, because the only thing that can stop this now is an avalanche of solidarity to meet the avalanche of human suffering in Gaza. And this avalanche of solidarity is needed very fast, because as the hours pass by, more and more people will die from preventable causes, both diseases, complications to the wounds, and new killings and new wounds in Gaza. The ceasefire is not going to solve anything. It is very good if it comes, but this is not a difficult conflict. This is a difficult occupation. And as medical workers, we need to know and to remind ourselves we do not treat symptoms, we treat root causes. And the root causes of all that we see is the occupation of Palestine. It is the colonial apartheid policies of Israel, and that needs to be addressed. Otherwise, we may be complicit in only drying the blood up from the floor and patching the wounds. That's important, but we need also to discuss the deeper reasons for this horrible crime against humanity that we see in Gaza now. And I repeat what my colleague in Cameroon says. Gaza is slowly dying and awaits an unknown future. They are not pessimists. They are the shining stars of smooth and resilience. But they are extremely exhausted after 5 weeks on call. And he added, I didn't say that, but he added, we are getting slaughtered as the world has to be watching. I'm happy to be in this webinar because we will not be Catholics. Thank you.
Thank you, Max. It's a harrowing picture you actually paint of the conditions in Gaza, and I know you know these conditions very well. Especially now, the weather conditions are deteriorating. You're right, it's really horrific. But at the same time, thank you also for your testimony about building solidarity And building solidarity, that's also what Rupa is going to talk about. She's Associate Professor of Medicine at the University of California, San Francisco, co-founder also of the Do No Harm Coalition, and that's an organization that considers state violence as a public health issue. And she will talk about the challenges of building solidarity in the United States.
Thank you so much, Mads, for your work, for your voice. You've activated so many people here on with your online presence. I'm very grateful to be invited into this conversation. I come actually a day after about 700 healthcare workers were stationed in seven different spaces in the Bay Area, specifically with the demonstration of solidarity for the people of Gaza to demand unrestricted humanitarian aid, to demand a ceasefire, and to push for the end of the occupation of Palestine. This avalanche of solidarity is absolutely what's required. I come to this conversation as someone who studies the health impacts of colonialism. I'm speaking to you from occupied unceded Ohlone territories where I was born and raised, and have been looking at the impacts of colonialism worldwide, but specifically the violences of settler colonialism in the United States and how they are applicable to our analysis of what we're seeing happen in Israel and Palestine. And so the frustration States has been fascinating for me to watch. I'm someone who offered medical care at the request of Indigenous people standing against the Standing Rock pipeline. During that encounter where we were bombarded with chemical gases from tiger swamp, a military contractor that cut its teeth in the Middle East, the American Medical Association just a week and a half ago, 135 medical students, residents, and fellows, together with the Minority Affairs Group, came together to propose a ceasefire resolution at the AMA. The democratic process that House of Delegates proceeds by was overrun. The speaker, the young resident who put forth the resolution was not allowed to speak, his 90 seconds. And the people, the powers that be in the AMA shut down even the consideration, even the discussion of a ceasefire resolution. And we're seeing that kind of exertion of silencing happening even within our own institutions. So at UCSF, where I work, residents put on a slide. These are residents who are part of a health equity program at UCSF, so that they're supposed to be studying the structural determinants of health. They're supposed to be analyzing how power predisposes certain peoples to worse health outcomes, and there is no worse health outcome than what we're seeing in Gaza with the enacting of Israel's genocide against the people of Palestine. And so when they did put up a slide that just described what was happening, the attacks on healthcare, the disproportionate impact, especially on children, the department chair walked out of the room and sent in an email the next day saying this was not acceptable to be speaking about this, and it made some people feel unsafe. So that is, to me, an interesting thing to look at, because as we look in the United States, there's been an obsession with looking at structural determinants of health, with looking at the anti-racism. Task forces have popped up everywhere since George Floyd. But what we've seen since the murder of George Floyd and this explosion of discussion of anti-racism is a lack of analysis of power. So doctors are not trained to understand or analyze dynamics of power. We do not get in there and expose why is it that people are being silenced at every level of our institution. And that is an issue that we're going to start looking at through the Do No Harm of the people who are resisting the call to be silent. We cannot be silent as our colleagues are being murdered across the way. We cannot be silent when we witness such great injustices. We cannot be silent as hospitals are being bombed and clinics are being bombed. When doctors from MSF are being killed, we cannot be silent in these circumstances. I think that looking at the vituperative reaction to people saying stop bombing hospitals is an important moment to look at how this issue gets at the heart of the colonial world order that so many of us have been articulating and understanding as a direct impediment to health for all. And so if we're serious about health for all, we need to get in there and analyze how people are being silenced and how we need to push forward and get into the architecture of power in medicine and analyze and dismantle it so that these systems can actually be used to serve all. There is no circumstance where hospitals should be bombed. There is no circumstance in looking at Israel now trying to manufacture evidence that there are tunnels under the hospital, tunnels which they in fact built, and that these tunnels host Hamas and all of these fabrications that we've seen in the media, while we're witnessing ICU patients die, while we're witnessing NICU patients die, while we're witnessing physicians and nurses and other medical workers die. This is a horrific, dark charade that needs to be named as such, and healthcare workers around the world need to actually unite and speak out as much as possible in this moment. So the avalanche of solidarity will come, must come, and we will do our part here to support that. Thank you.
So thank you, Rupa, and thank you for providing also some context and explaining how our colonial world order is actually an impediment to health for all. And your testimony about the challenges of building solidarity in the US. While we're trying to get Mustafa Barghouti from Ramallah and Yaghi from Gaza on the call, we have another speaker from the north, from Brussels. That's Dr. Hanne Bosselaars. And Hanne is a family doctor with Medicine for the People here in Brussels. I also have. And she's been working in Gaza about 10 years ago. So she has some experience also over there with this organization, with AUDA, that was targeted today. And she's since that time working as a family doctor in Medicine for the People, which is both a family clinic, but also an action center in Brussels, building active solidarity. And that's what she's going to talk about.
Hello, thank you, Will. Thank you, Max. Rifa, I'm happy to be here because I can barely contain my rage about what's happening in Gaza to my direct colleagues with whom I worked in 2013. But indeed today, I want to focus on this wave of solidarity that is coming. I feel it. I work in Molenbeek, in one of the neighborhoods of Brussels, which is especially migrant population. So a lot of our patients of our primary healthcare center or medical action center come from Morocco. So they have a tradition in solidarity with the Palestinian people and they are very sensible to the cause. And so when I went in 2013 to work with the organization AUDA, it was to build a twinning between our Medical Action Center and one of their primary healthcare centers in Beit Hanoun. It's a Al-Quds Center, primary healthcare center and cultural center for kids, where I worked for 4 months as a GP, treating patients and working with the colleagues over there. I also did some prenatal consultations in Al-Auda Hospital. And it's a very good case to build direct solidarity, to establish this kind of twinning, because it gives the whole cause a face. You get to know people, and you're not talking only about statistics. The statistics, they are very useful for us, for activists, for healthcare workers, people who have to see the enormous needs, but it's not very useful to talk to people who want to do something, but they don't know all the historic facts. They stay far away if you don't hear them in by something concrete. And so the Twinning project has really offered a great opportunity to establish direct solidarity with Palestinians, with our public in Molenbeek. Our patients, since the beginning, since 10 years, they have been following. We have done video conferences with the colleagues of Al-Quds Center, and we have organized so many activities. Every Ramadan, we organize iftars where our patients, they cook, they prepare, they mobilize, they come with their whole families. They invite me to speak at their family parties where they pass an envelope to put support money in, and then I go out the door and I have thousands of euros to donate to AUDA. So having a direct contact and keep on talking about what they are going through is extremely important to raise solidarity. And what they are going through, I totally agree with Mats. It's not new. This targeting of healthcare facilities has been there since the beginning of occupation. When I was there in 2013, it was 6 years after the siege on Gaza, and they already had lack of medicine, lack of fuel. This blockade is just so suffocating. And targeting the bombing, blocking the killing of healthcare workers was there since the beginning. So it's a returning strategy. It's not something accidental. It's not collateral damage as they try to sell it. It's a real strategy to cut the people from needed healthcare. And as we consider health is a right, it's something we absolutely need to speak up to as healthcare workers. So I totally agree that it is a red line that has been violated so many times, so long ago yet. And this conflict, of course, this attack is so cruel, but it's not something that is new. What we are doing right now, since the 7th of October, is again raising awareness and talking about AUDA, talking about Al-Auda Hospital, which was one of the only hospitals that stayed open in the north. And they got their evacuation call on the 13th of October, but they decided to stay with their maternity and their emergency department, where they are still treating wounded people. Today they got bombed again and lost 3 colleagues. It's real direct targeting again. So tomorrow we will be going to our market again. Every Thursday we stand on the market in Molenbeek with some volunteers, very regular people who come every week since the 7th of October to ask for donations and to inform the people, to talk about what is happening. And you have these same people that come every week to give their donation and also to ask how is everything in Gaza? Do you have news? Is anything happening over there? They follow, but they also want to hear from us what is happening. So to have a direct link is really important to raise solidarity and to be able to gain the trust of people. So this large network of supporters and people who not only donate but also actively support and talk about Palestinian case and the Palestinian health workers is really important, and it's growing. So I feel that even people who were not so interested before are now feeling that they have to do something. And that's also something that can help against this collective depression. If you're just watching these terrible images all alone by your side without being able to do something, without having any possibility to act, it's horrific. You just slumber in depression and you get worse and worse. So I'm very proud of our twinning project because it offers an opportunity to do something. And I feel this in my consultations with my patients when we talk about Gaza, that they are grateful for this possibility to act, to be in contact with a partner that is doing healthcare on the ground, that is fighting for the right to health for their fellow citizens. So this is something that helps and that people are very sensitive to. There are a lot of other things to do, of course. We wrote an open letter signed by a lot of academics and healthcare workers in Belgium. Actions in the streets, of course, we have to go to massive demonstrations. We had a very big one on the 11th of November in Brussels, and every night people are gathering to do a silent wave and also manifestations at the Central Station in Brussels. So people are really getting into action. The call to action is it's getting bigger and bigger. So this avalanche of solidarity, it is growing, and it will put pressure on our respective governments. I do believe so. It has to grow. Another thing we do as healthcare workers is boycott Teva. So we never prescribe any medicine produced by the Israeli company Teva, and we put stickers on the prescriptions, Palestinian flags, so that our patients go to their pharmacist with a Palestinian flag. They sensibilize their pharmacists and other clients. So all of these actions are easy and raise awareness and give us the opportunity to continue talking about the Palestinian cause. So it's really important to have different action modes and to help people to get out of the collective depression and get active. That's also the spirit of our action centers. We do it for Palestine, but we do it for a lot of other campaigns as well. We want our patients to become actors of their own health, and that means having the opportunity to go to a movement, to join, to become active. Viva Salud, who is our sister organization that works with Palestine, so with AUDA, but also with Cuba, Philippines, Congo, is a very good sister for that. They work very closely together when we organize events. They come and present their actions. So they are very known to our public, to our patients, and so we can really make the difference. We can really establish trust. I think when people know that you have been on the ground, that you have been working there, it gives another image than someone who is talking about a project that is far away or talking about just statistics. So one of my advice is this: we should all go there, have tight contacts with Palestinians and talk about them, call their names and give first-hand information. It's really important, and I think that's what Mats is doing all the time, is translating this first-hand information into the world. It's the best kind of sensibilization. It's the one that is most heard. When it comes from the people, it will be heard and it will call others to action. We in this urgent campaign for AUDA, we really saw all the stages of misery and the lack of fuel. I hear them sending urgent appeals for fuel since 10 years, but I never thought they would really actually arrive at the point of no fuel at all. And we are almost 3 weeks past this point, and they are still there, they are still working, and they have still been bombed today. This is something that absolutely has to stop. And the bombs will eventually stop falling, the ceasefire will come, but I'm very, very worried for the future. I think this will take tens of years before there will be a reconstruction, there will be healing. But let's hope that this avalanche of solidarity will make a long-term change as well. I really believe that this could be one of the moments where the liberation of Palestine could be close. So please, let's gather, let's push, let's all reunite our efforts to free Palestine now. Thank you.
So thank you, Hannah, and especially thank you for giving us hope. Just a while ago, I was still chatting with Yaghi, who is the director of the Palestinian Medical Relief Society, who is based in Khan Yunis in Gaza, but he hasn't been able to join our webinar yet because, of course, you understand that the internet situation is quite unstable. But we have also a voice message of the Auda hospital. That's the hospital that was bombed a couple of hours ago. The last message we received from Dr. Ahmed, the director, last night. I think America has prepared it and can play it for us now. And then after that, I would like to hear also from Mats, what's it actually like to work in these conditions in the hospitals of Gaza. But let's listen first, maybe America, if that's okay, if you can play this voice message for us. Then can play it for us now. And then after that, I would like to hear also from Mats, what's it actually like to work in these conditions in the hospitals of Gaza.
I would like to describe the situation in Auda Hospital in the northern area. Shortly, the situation is critical in the northern area, especially last 2-3 days. The bombs around the hospital increased fancy and a lot of attacks, air attacks and tank attacks and snipers and gunshots, and the Israeli army reach around the Indonesian hospital, close to Al-Auda, a couple of meters, couple of 100 meters to 200 meters away from Al-Auda hospital, Anyhow, inside, in Al-Auda hospital, providing services for all patients. I mean emergency in general surgery, orthopedic surgery, plastic surgery. We didn't stop at all. Even we haven't any fuel, but we have a small generator supporting the UPS, which support some points in the operation theater light, and the surgeons using light with chargers. We are doing our best, and we all the hospital in the Gaza City and the northern area is working now. All the hospitals out of service, closed. Even Indonesian hospital today, the patients leave the hospital and the employees even, and some of them reach out the hospital, and we admit 6 patients, and we provide services for them for 5 fixations, and tomorrow we schedule another one. Gyn Ops, we are working in good way, and we are delivering normal and spontaneous. This is the last year.
So that's Dr. Ahmed Mahana from the Auda hospital that was hit by Israeli bombardment today. But Mats, you've been working in these conditions also in Shifa and other hospitals in Gaza. Can you tell us more about what it's like to work as a doctor in these conditions?
Yes, thank you. I think there is an important reflection we should make when you watch the videos and when you watch all the horror coming out from Gaza. Most of the time we look for things that are not functioning. We look for the horror, we see all the blood, we see how unbearable the pain and the suffering is. But more seldomly we look for the strength and the capacity and the mastery. And in this balance between suffering and strength, we might easily end up with pity, which is, for me, it's a very kind of colonial type of shades to have on. You pity the people, and you talk about pity, they're so sad, it's so bad. But when you listen to this voice of our brother in Gaza, how he describes how they continue to work, how calm he is, how carefully he chooses his words, how contained the report is, how balanced. And yet you really feel the tremor in his voice. But this dignity, and this mastering, and this grace that my colleagues work with has made such a deep impression on me since I first time saw it in Beirut in 1982. And I've seen the same during all the attacks on Gaza, and it was during 2006, 9, and 12, and 14, with all the horror and all the bombing, and every time you think it can't get worse, and it gets worse every time, and the worst we've ever seen is this. But for example, if you saw the video from Shifa, when they got 1 hour to get out of Shifa, and there is a video where you see how systematically they work, how calm they are, no screaming, no shouting, everybody's helping. And to me, this is one of the most striking features about not only the Palestinian healthcare system, but the Palestinian virtue of su'ud, which is an Arab word, which I think it means something like steadfastness. But su'ud is part of the Palestinian virtue. It's part of their character, and it is an extremely rooted dignity that you see in the most chaotic situations. There may be a little bit of a high voice, a pitch, no impoliteness, no pushing, no aggression between people who may be constantly stressed. I can be very stressed. I'm an emergency medical doctor and anesthesiologist. I'm used to, the hot and hectic major trauma situations. But when you get 400 trauma patients in one rush in one night, like we did in Shifa on the 20th of July 2014, during the massacre of the Sheshaiya neighborhood, you see how they sharpen up. They are very concentrated. They have very good triage systems, how they do the triage, the sorting, and a very quiet discipline that always impresses me. And I think through all these following videos and pictures we have seen, try to look more for the strength and not look so much for the misery and the suffering, because pity doesn't get anybody anywhere. I was speaking to a crowd of 1,700 people last night in Cape Town, a massive solidarity meeting. I guess half of the people were healthcare workers. And in a way, I tried to describe how I myself have been taught by the Palestinian people and by the Palestinian healthcare workers to look more for the remaining capacity than to look for the failure, and to try to underpin and support and facilitate that remaining capacity. You might compare it to a COPD patient who has dyspnea, and we come rushing with CPAP and oxygen and everything, instead of just, would you like to sit a little bit higher and get your diaphragm a little bit lower so you have a better pressure system in your lungs? And yes, and we might open the window. Is that facilitating your breathing? Instead of always going in and taking over. And I think in this situation, they need more than ever. And I heard it in the inside story we just made with Al Jazeera. We have both Marwan, who is a volunteer in Khan Yunis, and he said that we appreciate so much all the free people of the world who supports us, who stands with us, and not just watch us. So this general note on what I have learned from the Palestinians. And a famous African leader, Samora Machel, who was a fierce guerrilla and became the first president of Mozambique, he said, solidarity is not an act of pity. No, he said, solidarity is not an act of charity. It's an act of solidarity between. It's an act of union between people fighting on different grounds towards the same objective, the same goal, which is equality, democracy, justice for all people. So solidarity is different from charity, and I think part of the colonial structure that we have to get rid of in medicine is this colonized relief industry that all the time paints a picture of the occupied and the people in the global south as less competent, less knowledgeable, has less capacity than us. So that as an introduction to how is it to work in Shifa or in Al-Quds hospital when there is bombing, you hear the drone, and you get loads and loads and loads and loads of the most horrific former patients. That's when you see the greatness of the Palestinian healthcare workers, because they never allow themselves to be degraded or to behave like the animals they are treated like. They maintain their style, their politeness, they look after each other. There's a lot of encouragement. We touch each other a lot. We hug. We always greet when we meet and depart. There's always a cup of coffee or a cup of tea coming up, even if we don't have it. There's always this little, an arm around the shoulder when we have a break. And in the operating room, it can be intense, but you have this deep feeling that we're all on the same side. It's not like I can, in my brilliant university hospital in Norway, who, by the way, have sent me on this mission. I'm released from my clinical duties because my hospital, after 40 years of work, has now defined itself in a way as also a solidarity hospital with international commitment. So when I travel now, I don't travel on behalf of the Norwegian Palestine Committee, which I did the first 20 years. Now I travel as a senior consultant in my department of emergency medicine, and I have a laissez-passer letter from my director of the hospital. And we got $1 million from the Norwegian government for this mission we're on now to go to Gaza. So we have established a pretty broad-based solidarity platform. And when Rupa talked about the harassment of a simple, dignified thing as solidarity and standing up for your colleagues in Gaza, I get this feeling of a big bottle of ink being poured out on a white, beautiful linen on the table, not to do a Rorschach test, but to just darken humanity and to take away the most fundamental right, which is this. The two most beautiful words I have in my language is love and solidarity. And to deny people solidarity and to deny people to act in solidarity is a way of weakening precisely what they fear, the alliances between North and South, and the rock-solid alliances between people who fight towards the same goal, but on different terrains. Solidarity is not an act of charity, it's an act of unity between people fighting on different terrain towards the same goal. So when you are fighting racism in the United States, so much needed, when you are fighting the anti-colonial struggle with your native people in the reservations, it's precisely what they fear, because they are getting more and more and more uncovered, because we work on decolonizing our minds, at least I do, and I try to get rid of my own Orientalism. And in that activity, what I have noticed is that I learn more and more and more from my colleagues in Gaza. Not only the doctors, maybe even more from my friends and brothers and sisters in the ambulance service, and the janitors, and the technicians. Because you know what? They all consider themselves as part of the resistance. And what is being totally obfuscated and tried to sort of hide, it's enough to say Hamas and then you're a legal target. Hamas is two things. It's a military wing and it is a civilian sector. Just like in my country, we have a Ministry of Defense and we have a Ministry of Health. Sharply divided in their function and in their legal protection and their legal duties, to put it that way. Ministry of Defense has to educate their soldiers on the Geneva Convention. I have to be educated and educate my students on the patient rights. But it's a system where a society has something to defend themselves and something to treat and show care and compassion in the healthcare system. Why shouldn't the Palestinians be allowed to have defense? Why shouldn't they be allowed to have a healthcare sector that actually defines itself as part of the resistance, which we do in Norway? Because when we discuss preparedness with regards to war and attack, that we discuss a lot now, the healthcare sector is an integral and very important part of what we call the total defense of Norway. Of course, the Palestinians have the same right. Unlike the Ukrainian people, they have the right to resist occupation with arms. And this double standard, I don't have to get into that, it's horrific. But what we see when I work together with my Palestinian colleagues, it's an immense dedication to the patients. They may have some different standards on how much pain you should take. Make a note that no patients are going through major surgery in Gaza without proper general anesthesia. They may lack local anesthetics, but they will not do laparotomies or tourniquetomies or cesarean sections without proper general anesthesia. I have that confirmed. I've seen it always. And they keep very well, to their small doses of ketamine and propofol and the other things that we use as tools to have pain relief. But they may have to do some procedures without local anesthetics. Why don't they have local anesthesia? Because Israel don't want the patients to have pain relief. How can I say that? Well, they had, before this attack, the essential drug list defined by WHO was filled up to 40%, 40. So they were missing 60% of the essential drugs. Still, they managed. So they improvised. I remember in 2009, during Operation Castlead, we had, they had 6 operation rooms in Shifa, and we had 15 patients who needed life-saving surgery, like, damage control surgery. And 6 operating rooms, 15 patients, what do we do? You know what they did? They just rolled in an extra operating table in each room, so we went from 6 to 12. Increased operation capacity by 100%. And I could perform anesthesia on 2 patients with a nice anesthesia nurse as my helper. And then there was 2 surgical teams doing 2 life-saving surgeries in each of the rooms. They are masters of improvisation. They find simple solutions to quite pressing problems. And they have a system of documentation, which is quite impressive. I have published a number of papers in the Lancet on patient flow during the attack in both 2009 and 2014 as well. And we have published a few papers on amputation injuries. And it's easy to access their database. It's not digital, it's handwritten. And their protocols are, like if you came to an OR in 1960 in my hospital, it's all carefully written down, name, patient, date of birth, type of injury, type of surgery, who we're operating. So to conclude, it's really a teaching experience to work in Shifa or in Al-Quds or any hospital in Gaza during bombardment. It's a teaching experience of human greatness. It's a teaching experience on human sustainability and resilience. And it is a teaching experience on a culture that stands with other values than we see in the profit-oriented healthcare system that we have developed during capitalism in our systems. Because I think actually, without romanticizing too much, the national struggle in Palestine is the paramount overruling glue that keeps them together, because they're in this for a greater cause. This is not a difficult conflict, this is a difficult occupation, and they're all defining themselves as elements in the resistance, because the total resistance, as we talk about in Norway, total resistance is healthcare, it's water supply, it's food supply, it is storages, it's gas masks, it's everything, and the military. And of course, they have the right to have all of these elements. So there's a lot to learn from Palestinian healthcare, and there's some mood. Well, don't get me into it because I am very emotional. We just got the message of having lost another graduate medical student from Al-Azhar University. I got the WhatsApp message now, Dima, killed. And we have lost quite a number of our group, research group and project group in the bombing. So it's painful and close, and yet they don't give up, and there's a lot to learn from that. And we need to decolonize our mind and understand that this structural violence that is so evil and so mortal, we have to stand up against it, and we have to be in solidarity with our colleagues in the US, with Rupa and her allies, because they should not stand alone. We need to expand solidarity, both vertically and horizontally, to put it that way. And I made the expression an avalanche of human suffering and an avalanche of solidarity, precisely to describe how much each of us can contribute, and each of us can be part of that avalanche. Thank you.
Thank you, Mats. Love and solidarity, apparently the most beautiful words in the Norwegian language. And we also learned about Sumut, about resilience in Palestine. I'm very happy that Yaghi, the director of the PMRS, the Palestinian Medical Relief Society Gaza, has been able to join us. And I would like to ask you, how are you? I hope you're safe. I know that nowhere is safe nowhere is really safe in Gaza, but we're very happy that you're here with us. Can you tell us about the situation right now around you, and how have you been experiencing these past few days of more intense fighting around you?
Okay, Wim. Thanks, dear Wim. Thanks for everyone for giving me this opportunity to speak for all of you. First of all, I am well, as other Palestinians here in Gaza. We don't know if we will be live after a few minutes or not, but it is our life. It is our life. Everywhere it is too dangerous. No safe place, even in the shelters, even in UN shelters. Let me start because it is too difficult for me to start from which point to speak about the situation here in Gaza. Because it is not only humanitarian crisis, or it is extreme humanitarian crisis, or it is a crisis of humanity, as UN Secretary General mentioned before. No, what's happening in Gaza now, it is a genocide of the Palestinians. It is even the war crimes, it is not enough to reflect what is happening here in Gaza. I think it is this time and this period, it is too difficult period for Palestinians, but at the same time, it is a test for the international community, who usually repeated and educated the Middle East and Arabic country and Palestinians about the international law and the human rights. I am sorry to say that there is an absence of the international law, and there is no respect for any human rights for Palestinians in general. Maybe you remember when few weeks ago, we as medical teams appealed about everything about the situation. We usually appeal that we are running out of everything, including medication, which it was being shortage in September. Last September, WHO reported that there is a shortage of medicine in Gaza Strip, which is 40%. Also, the in the end of September that the shortage of medical supplies and other medicine which used in emergency department and in operational room, it is also shortage in 24 vaccine. Can you imagine that? How's the situation when we're facing now, when there is thousands, 10,000s of injured people in 46 days? We appealed before that we are running out of everything. We appealed that we are running out of medication and other medical supplies. Several times we mentioned that the people are having surgery without pain relief and the injured waiting at operational rooms for a few hours or sometimes for a few days to do this operation. This appeal and this speech and this presentation, it was being a few weeks ago, but now we are inside the problem. Now we are worried about the rest of Palestinians, the rest of 2.3 million of Palestinians, because until today we are speaking around 50,000 Palestinians, 50,000 Palestinians. More than 14,000 they are killed by Israeli army, and more than 35, maybe now 35,000 were injured. We are speaking about at least between 6 to 8,000 Palestinians still under the rubble. And of course, we have many calls, we have many warning about that there are thousands of Palestinians, they are missed. We don't know where they are, if they are killed or if they are injured, or if they are arrested by Israeli army. Why is that now? We don't worry about only this 50,000. We are worried about the rest of Palestinians who are now facing a huge problem, not only due to the Israeli bombing or killing, and even because the shortage of food, shortage of clean water, shortage of milk for the baby. We are now here in Gaza, we are living inside catastrophic. Because first of all, we should to take care about the injured people. We should to take care about the patient who are suffering from heart attack, from kidney failure, or about the children who are needed for vaccination, or about the pregnant woman, especially who are risky pregnancy. And we are worried about all of this. And in them times, we should be worried about more than 6 million Palestinians. They are in the shelters now, especially in the winter. 1.6 million Palestinians, they are in the shelters, half of them in UN shelters, and there are some basic services, but it is not enough. But when we are speaking about other Palestinians, who are weak, now we have around maybe 700,000 Palestinians, they are in non-official shelters, or in the streets, or in the hospital, without any even basic services. We don't speak about only medicine. We are speaking about everything. We are here in Gaza living without electricity, without internet. The internet availability, it is not, you should to fight and you should to go to one place to secure the internet connection. We are running out of fuel. There are no gas for cooking. There is no transportation for the people. Even there are no transportation for medical team to visit the shelters. I don't know about what to speak or about what. We are facing many or maybe hundreds of stories of people. I don't remember if I told you when or not. 3 weeks ago, I visited one of UN shelters with my teams. Father of the daughter, father stopped me when he knows that I am from Palestinian Medical Relief society, and he desires. My daughter, 12 years, she is following a newborn disease center in Gaza, and she is in needed for her treatment. She is suffering from diabetic type 1, and she is regular visit our center to do some investigation and to do medicine and to receive her medication. But sorry, I cannot help her because all our medicine it is stopped in Gaza and we cannot reach our center to bring this medicine for his daughter. Of course, I cannot help her. Many calls in the last 10 days I received for different families. They asking for wheelchairs to carry their parents, old patient, because the Israeli occupation army, the Palestinians who are living in Gaza, to leave Gaza walking. They should to walk 5 kilometers to cross from Gaza city to the middle area. And those people, they called us because we have a lot of wheelchairs in Gaza, but we cannot reach them because our center it was being surrounded by Israeli tanks and they are shooting everywhere. It was being very difficult for me after 2 days when I received a call from one family and they informed me that their mother was killed by Israeli army when they evacuated Gaza. They asked for me 2 days. It was been 2 days only before they asked about wheelchair to take her from Gaza to the middle. I cannot even guarantee to provide them with their wheelchairs. Sorry to say that only 2 hours before I received SMS because there is no connection with northern area. I received SMS from my friends, my colleagues from Al-Auda hospital. The Israeli army targeted them directly. They targeted the third and fourth floor from the hospital. And I received a call that I am not sure, 3 or 4 at least they were being killed from our medical teams. Sorry to say that, but during the last, of course, I haven't updated the last, not only myself, even the Ministry of Health, they cannot now update their statistics for the last 10 days. But at least, we have more than 205 from the medical team were being killed during the 46 days. We are speaking now only 7 hospitals in Gaza Strip are operating. The rest of the hospital, we are speaking about 34 hospitals in Gaza Strip. 7 only, they are operating in middle area and Rafah. And partially, Al-Auda Hospital and Al-Andonisi Hospital, they are partially working in the northern area of Gaza. In city, the biggest city of Gaza, Al-Shifa, the main hospital in, not only in Gaza city, in Palestine, the biggest one, now it is not functioning. Today, I heard that we have only 4 or 5 physicians. They are still at the Shifa hospital to take care about the injured people who are stuck in a Shifa hospital. We have 281 injured people still at the Shifa hospital, and they cannot move because they are in needed special coordination for them to evacuate the Shifa hospital to the middle area or to the southern area at Rafah. Too difficult for me to explain more, but we are speaking about only 6 or 7 ambulances still operating between Gaza City and northern area, and they are running out of fuel. Even Al-Anbunisi Hospital, the main hospital in northern area of Gaza Strip, even yesterday and this morning, this morning, they succeeded to evacuate 120 injured people from northern area of Gaza Strip to Rafah. Too difficult for me to explain about what's happening in the shelters. In the shelters, even you cannot imagine what's happening. It is some shelters which designed for only 1,000 to keep only 1,000 or 1,500 people. Now we are speaking in one shelter in Khan Yunis area, more than 40,000. It is a small area, crowded area, without water, without clean water. Sorry for the people, especially the old people, they should to wait between 4 to 6 hours to go to WC. You understand, when the diabetic patient or old man, he should to go to WC. It is too difficult. When you are every day you are going and you should to spend 2 hours, 4 to 6 hours to find some bread or to find some food for your children, and to wait another 1 or 2 hours to guarantee at least some water, and if sometimes it is not drinkable water, but it is water. It is too difficult when you are visiting the shelter in this winter time. It is cold now, and you are people with short shirts or t-shirts only. In this time, it is too difficult to explain about everything here in Gaza. But the important, the people, they are know that they are paying the price. They are paying the price to be free, to be freedom as other people in the world. We are dreaming about that, and I hope the day it will be reached. If not today, it will be tomorrow. Final thing to mention, father, he is witness first Nakba. My father, he is 94 years. I am living in Gaza City with my family. When we are glad to leave Gaza to middle area, because it is safe area, he told us that it is the second Nakba. It is the second Nakba for us as Palestinians. And think maybe it is worse than the second Nakba. Of course, I don't attend the fair, but what I said, what I saw every day in the life, in the streets, it is second Nakba. Sorry for that, but I should stop here. And of course, I will be with you if there is some questions and more clarification. Again, thanks for organizer for this work. And I hope that it will be with your help, with your solidarity. You should to do more pressure in your government to reach soon the ceasefire, because it will be too difficult for Palestinians here in Gaza to live more. Thank you.
Thank you so much, Shahid. It's a very heart-wrenching testimony, but at the same time, your voice is so strong, and only the power of your voice gives us strength and hope for you and for your people. So we don't have the capacity now to, or the abilities to open the floor for a Q&A with all the participants, because we are a lot on the call. But I would like to ask Hannah and Mats if they still have questions for Ayat, or still want to give their remarks on this testimony.
Well, if I can, I would like to ask if there is any estimates on how many people are left now in the north of Gaza without any services, without anything. Are there still people in their homes left in the north?
Maybe Mats first.
I mean, I just want to, I'm a bit out of words, but I want to say to my brother in Gaza that we will increase our efforts to the maximum we can to put pressure on our governments. And I think you are 100% right. Our duty is to pressure our governments in and outside EU and in the US to act as human governments and to stop the Israeli genocide on the Palestinian people. And the more pressure we can exert on them, the more is our solidarity useful for you. We have to limit our talk and increase our action. We need much more action. We need to occupy our Minister of Health, our Ministries of Foreign Affairs. We need to make much more direct demands to our governments, confront them with their historical position. Those governments who are sitting idle now will write their names in the black pages of the history book. Like all those governments who turned their back to the Jewish people from 38 to 45 and looked away despite knowing what was going on in the concentration camps. The moral responsibility is enormous. The Palestinians are receiving next to nothing from the global north when it comes to the most minimal support, except for some whispering about humanitarian blah blah. So we stand in solidarity with you, our brothers and sisters in Gaza, with our immense support. We have to do more than talk. And I think actually the Jordanian government acted with courage when they broke the siege with 2 Hercules airplanes and flew in, did not coordinate with the Israeli occupation army, they just informed them, and they flew in with 2 military Hercules airplanes and airdropped a field hospital and medical supplies in clear breach with this unilateral siege that Israel is allowed by the West to uphold on Gaza. We cannot wait anymore. Our colleagues are killed as we are speaking. Our patients, if there is a global patient, and there is a global patient, the patient who is the responsibility to anyone who is in healthcare. Our patients are dying in Gaza while our colleagues are fighting a heroic struggle to save them. But we can't just sit there and praise them. We have to get up and do more. And this avalanche of solidarity has to get concrete expressions. We need to hit them with the money, where the money is. We need to map every hospital's supply chain of medical equipment and go into whoprofits.com and find out which of these companies are actually having either Israeli owners or having strong ties with Israel, and demand from our hospital leaders to stop using any material, any supply chain from medical companies who are having ties with Israel. And we have to go much more offensively out and organize. And I know for sure from what I saw this morning in Cape Town, hundreds of thousands of young medical workers, they do not accept this because they see the fascism, they see the colonial aspect, that they see that we cannot accept in any way these stupid arguments about defending your own country, which Israel is getting away with. So, my friends, when I listen to Dr. Aid, I'm very moved. I'm very proud to be a friend and a member of the Palestinian medical community. I've learned so much from you, and I want to thank you, my brother, for being so courageous and so dignified. You are our moral compass in the world today. In this fog of war, in this fog of lies, you stand tall as lighthouses of morality and the decency that every health worker in the world should learn from. Stay by your patient, oppose colonialism, racism, and apartheid. I'm proud to know you. I hope you will survive, and we will come in as soon as possible. I travel to Cairo tomorrow to keep knocking on the doors of Rafah, which are closed by the Israeli government and the Israeli occupation forces, but we will get to you. Make no mistake, we will get to you, and we will support you until our death. Thank you.
Thank you, Mats, for these very powerful words. I would like to give you the last word, and there was also a very concrete question from Hannah. Are there still people left actually in the north of Gaza? Right? Do you still, yeah?
Yeah. Thanks again, and thanks for Dr. Mats. He is, of course, he is our brother. He has witnessed all our suffering for the last 15 years, at least here in Gaza. I know that he was being outside also here, Palestinians. And I am sure, Dr. Matt, we will meet soon here in Gaza. And also, we will treat all our people here in Gaza, and we will be together to rebuild again all the hospital which was being destroyed here in Gaza. Again, I haven't enough words to thank all of you for your solidarity. I know that it is too difficult for you to demonstrate everywhere, but with your help, with your solidarity, with your demonstration in the streets, taxis, at least to change a little bit from the opinion of at least of some countries. And I am sure with your continuous work and with our statements here, Sumud here in Gaza, we will achieve what we want. We want, as Palestinians, we want to live in a freedom and dignity with here in Gaza, in Palestinian territory, such other people in the world. We would like to live in peace. And I think we will witness, we will live and witness one day when we together we celebrate Palestinian independent state. Again, thank you. Of course, I don't focus in our work on the work of Palestinians, NGOs or CPOs or other organizations. It is not the time to speak about our work. It is the time to show the solidarity, your solidarity, and to thank you for everything you are providing for Palestinians. Thank you.
Mats, you still wanted to react, I see?
I just wanted to support Dr. Aid's strong words about rebuilding Palestinian healthcare. I think we should make a worldwide campaign now where we have hospitals all over the world and the hospital workers, or maybe the government, saying, we will rebuild Al-Aqsa, we will rebuild Al-Akhli Arab, we will rebuild Mustafa Al-Quds, we will rebuild Rantisi Pediatric Hospital, we will rebuild, and then mobilize an army of people who will actually do that practical work, because Gaza will stand up, Gaza will rise again. Don't forget that the insignia, the weapon for Gaza City is the bird phoenix. It's a very old city, 3,000 years plus. And the bird phoenix is the bird that always raises from the ashes. Gaza will raise with the Palestinian in the centerpiece, and we will support them. And I suggest that we start a global campaign to adopt hospitals that have been destroyed from different countries and different medical systems, and we take the responsibility to say we will join with the Palestinian brothers and sisters in Gaza to rebuild every hospital, every primary care clinic to a better and more strong healthcare system that will resist colonialism and occupation. That's a promise from my side. Shukran.
I just got the message that Mustafa Barghouti is still joining us. Anyway, we will record the message for those of you who cannot stay with us because we're already almost 1.5 hours into the webinar, and of course not everyone can stay that long, but we'll give it a couple of minutes more and see if Mustafa can still join us. Hannah, you still wanted to react?
Yes, I would like to react to Max. I totally support this idea of rebuilding the whole health sector of Gaza, and of course we know that Palestinians will rise, and that the Gazan health workers, who are the strongest of all, will rise and will be there for their people. So coming in to support and to push our governments to at least repair what has been done is a very strong message, and is something we can do. We count on everyone.
Ayed, you still want to come in while we wait for Mustafa? Yeah, go ahead. Yeah, let's.
No, I just want to add also that we who are fortunate to live in countries where you're allowed to express your support for the Palestinian struggle, we must not forget our colleagues and our friends in the United States that Dr. Rupa so graphically described. We will not accept any attack on anyone who is taking a stand for Palestine. Of course, we will not, and we need to be finding ways to expand our solidarity also to our struggling colleagues in countries which are pro-fascism in parts of their country and pro-colonialism still. So our hearts for you, and we will stand by you, and you are not alone. Thank you.
Let me add maybe something. Okay?
Yeah, go ahead. Yeah.
Okay, I think you heard something about the field hospital, some Arabic field hospitals, they enter to Gaza. Answer plain. Until now, we witnessed yesterday that the Jordanian field hospital, they enter to Gaza, and they are prepared themselves to establish this field hospital in Khan Yunis area, and only to know you, it is contain only 28 beds only, and we are not sure if they will receiving injured people or other patients. We don't know until now. We heard also about another 2 Arabic field hospitals. They were been coming to Gaza in the next day, but we are not sure about that. For you to only to know, we are speaking about in Gaza Strip, the capacity of the beds, it is less than 35% of the total beds in Gaza. And all this 35% of the total beds, they are occupied already with the injured people. We haven't more bed to receive patients. And of course, you heard about the humanitarian aids which entered to Gaza. But sorry for that, from the 1st of November until now, we are speaking 21 days. They allow only less than 3,000 trucks of goods, different goods. You can imagine that Gaza Strip before 5th of October, receiving daily between 500 to 600 trucks full with medicine, food, fuel, water, and others. Now we're receiving from the beginning of this Israeli genocide until today less than 3,000. It is enough only for 5 days in normal time, not in this such days, in this crisis. You can imagine that no fuel for the ambulances. We cannot move. We run now 23 outreach or mobile medical teams to visit the shelters. We haven't enough fuel to visit these shelters. We have capacity to increase the teams, but we haven't fuel to visit all the shelters. You can imagine in this time we are in 21st century, and the people, they are seeking for the fuel, for the ambulances, or for the vehicles. We don't speak about other things. Yeah, Dr. Mustafa joining us. Maybe he can.
Hello. Yes, thank you for joining us. We are already 1.5 hours into the call, and the Yaghi, you know very well, of course, our comrade from Gaza has been talking about the local situation. Gilbert has been talking about his experience working in Gaza. We had testimony from solidarity work in the US and in Europe, and we would also like to appreciate your views on the actual situation, and especially what you expect from us outside of Palestine. What can we do to support you and to redouble? Actually, we're really thinking about how we can redouble our efforts to build solidarity with the people of Palestine.
How much time is still left? Because if there is no time, it's all right. I can talk some more time.
No. We're happy to listen to you for the next 10-15 minutes. Please go ahead.
All right. Thank you so much. I have been waiting actually for a long time, but something was wrong with your technical system.
Okay. Yeah. Please go ahead.
Well, I think Dr. Aad spoke about our organization, Palestinian Medical Relief Work, where 25 teams are working on the ground in the north, in the center, and in the south of Gaza. And I think he gave you a very clear idea. What I want to say is that what Palestinians now are subjected to, not only in Gaza, but also in the West Bank, is 3 war crimes at the same time, in parallel. The war crime of genocide, the war crime of ethnic cleansing, and the war crime of collective punishment. And clearly the number of people killed is so tremendous. We're talking now, if we count the people missing under the rubble, you're talking about almost 19,000 people. That is more than 2.5% of the population of Gaza. Had this happened in the United States, you would be talking about at least 6 million people injured or killed by this terrible situation. The number of Palestinians killed, if you compare it to the United States population, would be more than all the people killed in the United States in all the wars of the United States since the 18th century. Mr. Guterres spoke about the fact that the number of Palestinian children killed already in Gaza is actually much more than all the children killed all over the world in all the wars during the last 3 years and probably 4 years. So it's drastic. What we need more than anything else is immediate ceasefire, immediate pressure on all the governments to initiate a ceasefire. Because without stopping the killing that is taking place, without stopping the bombardment, all the efforts will go in vain. And the problem is not only related to the number of people killed or injured. At this moment, there are 55,000 Palestinian women who are pregnant in Gaza, and about 5,500 of them will be giving birth, and some of them have already given birth in the streets. It's a big disaster. These women are now already suffering from malnutrition. and their children will also be suffering from malnutrition. There is not enough food, not enough medicine, not enough water, not enough clean water. One thing that is worrying us a lot now is the possibility of the spread of infections and epidemics. We are anticipating, because of lack of clean water, we are anticipating that there will be spread of diarrhea, but more complicated things like typhoid, hepatitis, and even cholera. Of course, with this crowded situation, some of my colleagues from medical relief told me that they have to sleep in the same room with 60 people. And in other cases, there are 200 people in one room that is no more than 16 square meters. So you are talking about, of course, very high possibility of terrible infections spreading. And we are absolutely sure there will be an outbreak of measles because all the vaccination programs have stopped since more than 46 days. The problem that we face today is that Israel has been attacking hospitals in the north and in the center with three aims. The first aim is to destroy totally the infrastructure in Gaza City and the north to make it to make it impossible to live there, to make it improper for people to live. And the main goal of this attack is not only to destroy the most important health services in Gaza, since Shifa Hospital is, by the way, was the largest hospital in mid-Palestine, not only in Gaza. Not only to deprive people from these services, but more than that, it's about destroying any possibility for people to come back. And it's about also evicting people. It is well known that thousands and thousands, at one point 60,000 people were taking refuge in a Shifa hospital. So the problem we deal with now is that since Israel could not up till now evict everybody out of Gaza to Egypt, and thanks to the steadfastness of the Palestinian people and their heroism, and thanks to the fact that our countries did not cooperate in this terrible ethnic cleansing plan, now the Israelis are turning to Plan B, which is complete and total ethnic cleansing of the north and center of Gaza. That's what should stop. And that's where international pressure should go, to stop the process of ethnic cleansing, to force Israel to withdraw its occupation from the area of Gaza and allow people to come back. Because Gaza cannot survive without the northern part of Gaza or the center of Gaza. On the issue of collective punishment, let me tell you that what Gaza received up till now does not exceed 1,100 trucks, while the real need at this very moment is no less than 26,000 trucks, because Gaza used to receive 500 trucks every day. And the most important thing is that they're not allowing fuel to go and flow into Gaza. Everything that relates to healthcare is a problem. We have more than 1,200 people who are in need for kidney dialysis. Many of them have already died. We have children who will die because there is no incubators for them, especially premature infants. There are people who have cancer who have already died and will die because there is no treatment whatsoever. We know that many facilities in Gaza are incapable of treating many diseases, and that's where people should be able to leave Gaza and come to West Bank or Jerusalem, and that is of course all stopped. So I think I'll tell you one story about what one correspondent described about the situation in the north of Gaza today. If somebody is injured, there will be no ambulance to take him to the hospital. If somehow some people take him and get him to a hospital, he will not be able to receive anything more than just simple first aid on the ground floor of the hospital, because there are no beds empty and the place is full with injured people who are not treated. Most probably this person will die. And after he dies, he will not be buried immediately because it is impossible to carry the body to the cemetery because of the Israeli continuous bombardment. And if there is a break in the bombardment, the cemetery is already full. And that's why now our colleagues in the Indonesian hospital are talking about finding a space inside the hospital to make it a graveyard for people. It's exactly what Guterres described as the fact that hospitals have been transformed into graveyards. So I don't want to speak too long because many people have already spoken, but I want also to alert you to the fact that we are also witnessing a lot of problems in the West Bank, where we are encountering not only army attacks on people, but also settlers attacks on people. What we face here is 750,000 illegal settlers who are armed to their teeth and who are terrorizing people, trying to imitate the same kind of terror that was used against Palestinians in 1948, creating the worst form of ethnic cleansing ever. And now they are trying to repeat that. Already 35 communities in the West Bank have been evicted because of the settlers' terror. We run about 14 mobile clinics. Medical Relief runs 14 mobile clinics in Area C, which is not served by anybody else. But even our mobile clinics have been prevented to reach many communities now in Hebron because of the army is preventing them. The same in Tulkarem and Jenin as well. So in the West Bank, we are also encountering this terrible attack. Already we've lost more than 216 people killed by the Israeli army since the 7th of October. And before that, 240 people were killed, including 40 children. And that's why, that is why, by the way, there was an attack on the 7th of October, because Gaza was responding to what was happening already in the West Bank. So what we need here is really immediate pressure on the governments. Any government that is not supporting ceasefire at this very moment is practically not only complicit with the war crimes that are happening in Gaza and in the West Bank, but actually participating in them. And that should be clear. It should be told to everybody that this has to stop, and immediate ceasefire is the most important thing that we need now. And then after that, we can speak about what will happen after in Gaza Strip. I am very glad that Matt told you and told us that he got $1 million as support from the Norwegian government. But I want also to alert you to the fact that the countries of Sweden, Germany, Italy, Switzerland, Austria, and EU suspended all their support to Palestinian non-governmental organizations, including all those working in the field of health. We're talking about 76 organizations that have lost the support now in response to Israeli pressures that is conducted by three very dangerous organizations. One is called NGO Monitor, the other one is UK Lawyers, and UN Watch. They're all run by Israeli intelligence, which aim is to dry up any support to any Palestinian living in the occupied territories. And the goal is clear here, to make life impossible, to break the steadfastness of the people. We will not stop struggling for our rights. We will not stop serving our people with our healthcare facilities, even if they stop all the support and aid from all over the world. But it is so shameful that some governments participate in the collective punishment of the victims, of the Palestinian people who are subjected now to this atrocity. So I think also you should raise your voice with your governments in these countries about this inappropriate behavior which is happening under the Israeli lobby pressure. My last point or my last request is that I think it is very important to bring in information to the people about the reality of what's happening here. I know there has been a big change already in the world, but we need more because the Israeli propaganda does not stop. And I want to clarify here that all they've been talking about regarding Hamas using hospitals as military headquarters and about the tunnels under the hospitals are all lies. We've exposed that already. And I want you to know that even Western media that is usually biased to Israel, including New York Times, CNN, Washington Post, and BBC, have all indicated and proven that the Israeli stories were incorrect and that Israel could not provide any serious proof of all the claims they were making about these hospitals. I think it was a scandal. And yesterday, Ehud Barak even reaffirmed the reality of this scandal about all the Israeli claims when he said, and Ehud Barak was the prime minister of Israel at one point of time, he said that one of the tunnels they speak about is nothing but an underground structure that Israel itself built when it was in charge of the Shifa hospital when they were occupying Gaza completely. So clarifying the reality to the world is very important. Informing the world about the reality of what's happening here is very important. And thank you for your support and your solidarity and for everything you do. I want just to add to what my colleagues said, especially what Dr. Aed said, that the cause of Palestine today is not a Palestinian issue or an Arab issue or a Muslim issue or a Christian issue. It's an issue of all humanity. It's the most important liberation struggle worldwide, and we thank you for all your support and solidarity. Thank you.
Thank you so much, Mustafa Barghouti, long-time member of the People's Health Movement. This was a very powerful message. And also very good that you talked about the West Bank, because indeed we need a ceasefire for Gaza, but this also reminds us that in the end we need to put an end to the occupation, not only of Gaza, but the whole of Palestine, of course. I want to thank you once more, especially Ayed, especially Mustafa, and I want to reassure you that we are with you and that we will continue to build the solidarity wherever we are. And I think that's the same also for the more than 120 people that are still on the call, even after more than 1.5 hours. So it's been very emotional, but also very powerful. And at the same time, you also give us hope. Mustafa, Ed, Mats, Hannah, Rupa, it gives us a lot of hope, and that's also what we need to continue the struggle for health and the struggle for liberation, and to continue building solidarity among ourselves. So thanks a lot, and hope to see you soon, and hopefully also in much better conditions. So thank you.
Thank you.